In this video, I'm going to discuss the link between the venous return and the cardiac output, and then discuss the condition that will shift these curves either upward or downward. So here on the y-axis, you can see that we have the venous return and the cardiac output. So we have one line for the venous return and then another line for the cardiac output. And then on the x-axis, we have the right atrial pressure or the end diastolic volume. So the question is, why once we increase the venous return, the cardiac output increases? So the reason for that is that with the increased venous return, there would be increased end diastolic volume, as a consequence of which you may recall from the Frank-Starling law, as we increase the volume of the heart by increasing the end diastolic volume, there would be an increased contractile force of the heart, and thus there would be increased cardiac output. So that is the link. The end diastolic volume is the link between the venous return and the cardiac output. On the other hand, if we decrease the venous return, then there would be decreased end diastolic volume, and thus there would be decreased cardiac output. So let me show you the Frank-Starling law so that you would better understand this concept. So for now, just ignore the purple and the red lines and just focus on the black line. So based on the Frank-Starling law, the contractile force of the heart increases as the cardiac fibers are more stretched. So as we increase the end diastolic volume, there would be more stretching of the cardiac muscles, as a consequence of which there would be increased contractile force of the heart and thus increased cardiac output. And so that's why the curve is having an upward trend with the increased end diastolic volume. So let's go back to the initial table that we had. As we increase the venous return, since there is now increased end diastolic volume, therefore there would be an increased cardiac output. Now, increased blood volume will shift the venous return curve upward. And thus, by increasing the blood volume, there would be also increased cardiac output. On the other hand, with conditions that decrease the blood volume, like for instance from dehydration or blood loss, then the venous return curve will be shifted downward, and thus therefore there would be decreased cardiac output. But note that with neither increased blood volume or decreased blood volume, there won't be any shift in the cardiac output curve. So cardiac output curve stays where it is, while the venous return curve either shifts upward or downward. Now let me go back to the Frank-Starling table to discuss the cardiac output next. So you may notice that here, conditions that increase the inotropy of the heart, like for instance the digoxin medication, shifts the cardiac output curve upward, while conditions that decrease the contractility, like congestive heart failure, shifts the curve downwards. So therefore, if we have an increased inotropy, then the cardiac output curve will be shifted upward. While if we have a heart failure, like congestive heart failure, then the cardiac output curve will be shifted downward. And that's an important concept that you should be familiar with. Now, there are also conditions that will affect both the venous return curve as well as cardiac output. And for that, I have provided you with a memory aid that will make the memorization easy. So conditions that decrease the total peripheral resistance, as a consequence of which there would be now increased venous return, the venous return curve shifts upward, and then from that there would also be increased cardiac output because there is now decreased total peripheral resistance, or the afterload. And conditions that decrease total peripheral resistance include, for instance, exercise or AV shunt, and I will explain AV shunt in a minute. And then conditions that will increase the total peripheral resistance, so they increase the afterload, like for instance epinephrine or norepinephrine, will cause the both venous return curve to shift downward, and then the cardiac output curve also to shift downward. So the whole point has moved downward because of decrease both the venous return and the cardiac output. While with the exercise or the AV shunt, since now there is decreased total peripheral resistance, the whole curves, both for the venous return and the cardiac output, has shifted upward. And so the memory aid that I have for you is that imagine that someone is running up there, so exercise will shift the curves upward, while here imagine that someone is sitting while it keeps repeating epinephrine, norepinephrine, epinephrine, norepinephrine. So these conditions will shift the curve downwards. Now I explained earlier that I will explain AV shunt. So with the AV shunt, what happens is that there would be a bypass of the capillary bed. So therefore, there would be an arterial venous shunt, as a consequence of which the blood will now bypass the capillary bed. And since they will bypass the capillary bed, as a consequence of which there would be decreased total peripheral resistance or decreased afterload, and thus all the changes that I discussed earlier will happen. So the cardiac output will shift upward, while the venous return also shifts upward. So that is seen with both the exercise as well as the AV shunt. And there is a bone disorder that actually causes AV shunt, and that is the Paget's disease, which is a bone remodeling disorder with increased osteoblastic and osteoclastic activity. Now with the Paget's disease, there is increased blood flow and increased vessel formation in the diseased bone, and one complication that may arise is AV shunt formation. And just as I discussed with you, AV shunt formation decreases the total peripheral resistance or afterload, as a consequence of which there would be increased cardiac output and increased venous return. Both curves will be shifted upward. So therefore, patients with Paget's disease are at risk of the high output cardiac failure. And just for your general knowledge, another complication with these patients is that because of the increased blood flow to the diseased bone, there could be excessive bleeding during orthopedic surgery. But the important point for your step 1 examination is that because of the AV shunt formation, there is risk of high cardiac output failure in patients with the Paget's disease. And that concludes our discussion.